is the staging of cancer. You must have heard that we say that some patient has the stage 3 cancer or stage 4 cancer. So what is actually these stages, right? So the stage 1 is usually unrecognized, but the stage 3 and 4 usually we get to know at the stage 3 and 4 where the actually treatment options get really reduced. So what is this TNM staging system? T refers to the tumor, M refers to the node, M refers to the metastasis. So there is the staging system which says that if you see the diagram here, if the tumor is from 0 to 2 centimeters, it is T1. If the tumor is from 2 to 5 centimeters, it is T2. So usually whenever a person gets diagnosed with cancer, there is this TNM staging given by the oncologist. So that says suppose T2, N1, M1. So what does this mean? That means the tumor is around 2 to 5 centimeters. The surgeon can actually feel your swollen nodes. Why nodes? Because it travels. Like if you have other doctors who treat cancer patients, they also evaluate tumor markers. These are blood tests, AFP, CA125, PSA, etc. So on initial levels, we actually recommend having blood tests, and if it shows any unusual thing, then the doctors need to do the final imaging procedures. The things to be kept in mind that we actually need to see a doctor. 90% you won't have cancer for this, but just it needs to be done. But a definitive diagnosis is actually made based on the evaluation of an individual's medical, social and family history. Physical examination, lab tests, imaging procedures. So basically it is confirmed by biopsy. Why we need good fats? Because there is an enhanced mobilization of free fatty acids from the adipose tissues resulting in the depletion of the total body fat. So in all, we need a good balanced diet as I mentioned. So why we need it, I just explained. So if there is an excess fat, there will be more insulin, there will be more estrogens, more inflammation. If there will be excess proteins, again more insulin and more insulin growth factors. Excess omega-6 also causes inflammation. So we must have started this thing also that omega-6 is considered as an inflammatory nutrient, whereas omega-3 is considered as a non-inflammatory nutrient. So basically, we need to have a good ratio of omega-3 and omega-6. So the common challenges faced by the cancer patient is usually fatigue. Why? I already explained you that cancer cell produces only 2 ATP molecules per cell. There is neutropenia. What can we do for neutropenia? We would have seen that the cell counts go really low in cancer patients. So in that case, we have to be very sure of the fruits and vegetables that we are telling the patient to have. That means we should be avoiding raw, undercooked animal products. There should be frequent hand washing, and there should be utmost importance given to the hygiene of the food. There is also altered taste or smell for the patients of cancer. They also have sometimes xerostomia, which is a dry mouth, and thickened saliva. So there are certain medications and certain nutritional techniques that we do for combating that thing. So for cancer survivors, there are 3 phases in which the nutrition recommendations are being made. First is when they are actually undergoing the active treatment. Second is when they are living with the recovery. And third, when there is advanced cancer, means metastasis and end of life. So in all these 3 phases, we have nutrition in the way. So what is the take-home message today? First, as I mentioned, we should be exercising regularly. We should be maintaining healthy body weight. Very important is to reduce stress also. So nowadays there is a lot of mental and physical stress. So very important is to reduce the stress. How we can do it? There are certain techniques that I already mentioned like yoga, and just taking 30 minutes for your own body every day will do the job. Third is reducing stress, and then is overall having a healthy diet. So that means healthy means what? Eating a diet rich in fruits and vegetables. We should be washing the produce thoroughly to minimize the pesticide exposure. So that is also there. A lot of chemicals goes in. We should be limiting the red meat intake. Consuming 2 to 3 servings of fish weekly. So if you are non-vegetarian, you should always prefer a fatty fish, but not a processed fish, right? You can cook it at home and not buy it processed. Why? Because there is a lot of salt and other things which are added while processing it, and which can act as a carcinogen. diet and the oil being reused. So any junk food may have trans fats. All the outside food is actually the main source of trans fats. Limiting the alcohol consumption and quitting, and we have to quit smoking. So many of the people, many of the men we have actually witnessed having oral cancers and other cancers as well. So maybe if there is an oncogene present, so if we are not giving that risk factor or that push to the body with the carcinogen, we can actually prevent it. And if not prevent it, at least delay it. So keep up with all the scheduled screenings. That means whenever, as I told you, nowadays, earlier it was like nobody used to get their blood tests done, at least at the young age. But now, after I would say 20 only, you should be getting your blood test at least once a year, which includes your normal CBC count, a normal blood report that needs to be done. And we should be seeking treatment if any lymphedema or anything unusual is happening to our body. If we feel that we are feeling unusually lethargic, or unusually some wound is not healing, or unusually we feel a lump somewhere in the body, that is an alarming sign, and that's when we need to go and see a doctor and get it evaluated. It may not be anything serious, but if it is caught at an early stage, there is treatment to it. I have seen myself patients who actually are there and they are suffering. They had suffered from cancer around 15 years back, and now they're leading a very healthy life. It is only here in Punjab that we feel if someone has cancer, that means it is the end of life. No, it's not the end of life. You can actually, it's just like a normal person. You just have to take care of a body that we otherwise also should do it. So one thing is, the research says at least 45 days we need to change a habit or incorporate a new one. That means even if we are trying to be physically active from tomorrow, so I believe from tomorrow. So at that point, at least it should not be like tomorrow, one day you are doing one exercise and after 1 week, okay, फिर से याद आया and then you are doing one exercise again. That won't help. At least 45 days to 2 months at least, you should be doing it regularly. Be consistent, maybe even for 15-20 minutes, that's fine. That actually builds a habit. And you will yourself feel change in your body, not only in terms of preventing cancer, but otherwise. So that was it. Thank you so much for your patient listening, and I would be happy to answer if there are any questions. Thank you.
Hey guys, if you liked our video, subscribe to our YouTube channel, Nutrition World. Hit the